I'm Gina and this is Scott, and we're physical therapists from Wheaton Franciscan Rehabilitation Services. Today we're going to go over some knee exercises that you can do after surgery when you get home. The first one we're going to start with is a quad set. So what you're going to do is you're going to straighten out your surgical leg, and you're going to tighten the muscle on top of your thigh, and you're going to hold for a count of 5. You're trying to push your knee down into the surface below you. Hold for 5 seconds and repeat about 10 of them at a time. Immediately after surgery, this exercise might be a little difficult, especially if you've had a nerve block, but just keep continuing to try and your strength will continue to build as you do more. Some key things to remember is you want to make sure that you tighten the muscle on top of your thigh and not your buttock muscle. This exercise is important to build strength in your quad muscles to get you better with walking and doing stairs and your overall general mobility. The next exercise we're going to show you for your knee is a straight leg raise. So it's going to build off the last exercise we did, the quad set. So you're going to tighten your thigh muscle, and keeping your leg as straight as you can, you're going to lift your leg straight up in the air. Initially, your knee will be a little bent as you do this exercise, but you want to make sure as you keep doing it that you try to straighten your leg out as much as you can. About to the height of your other knee that's bent on the other side. And you're just going to lift nice and slow up and down. And you can repeat about 10 of these exercises at a time, 2 to 3 times a day. This exercise is just a little more difficult than the last one, but again, it helps to build your quad muscle strength after surgery. The third exercise we're going to do for the knee is just to work on some knee range of motion. It's called a heel slide. So what you're going to do is you're going to just stay flat on your back again, and you're going to slide your heel and bend your knee as far as you can until you feel a nice, good stretch, and then you're going to slowly let it relax. Okay? Getting your knee moving right away is important in your overall recovery to gain your range of motion back, and you want to start that as soon as you can. If it's uncomfortable for you to do these lying down, you can also do these in a sitting position. So what you can do is sit at the edge of a chair or your bed, and you're just going to, again, sit with your knee bent and try to slide it back as far as you can, and then straighten it out. And just kind of go back and forth. You can have a sock on to make sure that you're sliding a little bit easier versus a shoe. And again, you can do these exercises 2 to 3 times a day. I'm Gina and this is Scott, and just remember that physical therapy is important in your road to recovery.